This morning, a mystery illness causing some paralysis in children, causing a major concern for health experts.
Joining us this morning in our studio is Dr. Noreen Khan-Mayberry. Right now, we want to know what researchers are saying about this. As a mom, that scares me to death. What in the world? I've never heard of a virus causing paralysis before.
Well, see, that's the thing. We don't even know if it's a virus, but they're calling it a polio-like mystery illness. Now, one of the enteroviruses includes the polio virus, and that does cause it causes paralysis. And so that's why they're calling it a mystery polio-like illness. But they don't want to call it a virus because, again, we don't know if this is a viral toxin or what it is. But it has affected 75 children across 25 states. And just last week, there was a cluster of 12 children that were affected in Colorado. So that's why all the attention has ramped up again.
And is there any sense that this paralysis is a permanent thing, or is it a temporary?
So in February, when they first started seeing cases, they noticed that it was permanent in a lot of the children, but in some children, they were able to return to school with physical therapy. Unfortunately, none of the children have regained full, range of motion that they had before.
What in the world how could this illness cause you to become paralyzed? Is it doing something to the spinal cord? What's happening?
It is. So what happens is after the children, experience, flu-like symptoms, they go into the hospital. Really what's happening, it's not so much the flu-like symptoms, it's just the acute flaccid paralysis, which means one extremity, one arm, or somewhere in their body just becomes limp and it's just paralyzed. So when they look at the MRIs, they see changes in the gray matter. They've also seen some changes, neuronal changes in other places in the brain. And so again, it's a mystery. In February, they thought they were onto something looking at enterovirus D68, thinking that if the children had been exposed to D68, perhaps this was the cause. Now, enterovirus D68 is a non-polio virus. So, and I talked about that a few weeks ago when I was on here talking about D68. But in Australia and in Asia, kids had the same type of symptoms, paralysis. They all had been exposed to D68. Unfortunately, we can't see a pattern here because several of the kids had not been exposed to D68, did not test positive for D68, and some of the kids had. And we also should note, all of the kids have been vaccinated against polio, and none of them tested positive for polio.
Interesting. So you mentioned the flu-like symptoms. Right. Talk more about what parents should be on the lookout for. And number two, if this is the road, is it an irreversible path down this way?
So when we're talking about flu-like symptoms, I'm specifically talking about the enterovirus D68. So if you see that, take your kids to their pediatrician immediately. And if you see any type of acute paralysis, if you can't get to your pediatrician right away, go to the emergency room, get an MRI, get a neurological consult involved, because the toxic mode of action is not fully known, but what we do know is that we have not seen full recovery, and it's very scary.
Well, since we don't know that much about it, is it just the typical ways of trying to stay away from this? Is it just go back to the good old hand washing and trying to stay away from anybody who's sick?
Well, I always recommend, using precautions in terms of, for our people in school, the teachers, the administrators, let's, kind of discourage all of the hugging. Let's try to stop some of the cross-contamination, but that's extremely hard. I mean, kids, they touch, they move around, and so it's very difficult to try to isolate that. But yes, having the kids wash longer, schools having soap in, the bathrooms is very important. Again, we don't know if this is an airborne virus. We don't know if this is a bacterial infection. We don't know what this is at this point, but what we do know is that the symptoms are very serious, and again, it can be permanent in some children, and some children are able to recover somewhat, but no full recovery.
Such a mystery.
Yes, yeah.
Never heard anything like it, but I'm glad you're here to tell us about it, so we are on the lookout.
Yes. Want everybody to pay attention and be aware.
Be aware. Thanks, Doc. We appreciate the wisdom.